Hello, how you doing?
Good, and you?
I'm doing great. My name is Abby Young, and I'm going to be your nurse today. Can you tell me what brings you here today?
Just an annual checkup.
Okay, so what I'll be doing is a head to toe assessment on you, and the first thing I'm going to do is to get started is go and wash my hands. Okay, I'll be right back.
Okay.
Okay. Okay. Now that I have my hands washed, okay, we're ready to begin. And first thing we're going to start with is I would like to ask you a few questions. Okay.
Okay.
All right. Can you tell me what's your name?
Jarrell Carmouche.
And how old are you, Mr. Carmouche?
I'm 18.
18? Okay. Do you know what year we're in?
Oh, yes, 2013.
And who is the president?
Barack Obama.
Okay, very well. So what we're going to be doing is a head-to-toe assessment. Do you have any history of any illnesses or anything that I need to know about?
No, ma'am.
Okay, well, then we're ready to begin. And where we're going to start at is I would like to assess your head. Okay? And as we can see, there's no bumps, no bruises, hair. It looks good, and scalp looks great. Okay. Well, actually, truly, I would have done vital signs first because it's important that we get your vital signs first. But because this is for a nursing student assessment, I don't have the equipment necessary to do your vital signs. So this is why we're starting with the head. Okay.
Okay.
But so we're gonna go back and we're gonna continue. So now that we know that the head looks great, we're gonna what I'm going to ask you to do is we're going to assess your facial. Okay? So what I want you to do for me is we're gonna I want you to make some facial expressions for me. I want you to blow out your jaws. Very good. Good. Okay. Now can you take your tongue and go on this side? Okay. Very good. And can you make it go to the other side? Very good. Okay. Can you smile? Good. Great. Frown? Okay. Wonderful. Wonderful. Great. Now what I'm going to do is I'm going to assess your sinuses. Okay. Palpate them a little bit. Does that hurt? No. And I'm going to do the ones on your eye. Can you just close your eyes for me, please? Okay. Very good. Okay. Now I'm going to ask you to open your eyes. And what I would like to do, I'm going to check your temperature right quick. Great. And I'm going to use my stethoscope, and I'm going to listen to them both. Okay, very good. Now what I'd like to do, Jarrell, is I would like to check your eyes. What I want you to do is close your eyes for me real tight. Okay, and I'm going to see if I can open them, okay? Okay, very good. And I couldn't open them. And if you just pick your head up a little bit, I'm just going to check the bottom of your eyes. You can open them up. Very good. You can just tie this. Look very good. Now what I'm going to do is I'm going to use my pen light, okay? What I would like you to do is just look straight ahead at that door over there, okay? And just keep your eyes straight on there, and I'm just going to shine my light, okay? Good. What I'm doing is checking the reaction of your eyes, of your pupils. Very good. Okay, now I want you to look at my little pen light, okay, and just follow it with your eyes. Great. Okay, now what I'm going to do is I want you to just look back at the door, keep your head straight, and just follow my pen light with your eyes, okay? All right. Okay, very good. That's very good. Now what I'm going to do is I'm going to check your ears, okay? I'm going to take my light and I'm going to look in your ears, okay? And I'm just going to check the structure of your ears. Okay, that feels good. No tenderness or anything?
No.
All right, and then we're going to do this side the same thing. I'm going to shine my light in your ears. Very good. And I'm going to check the structure of your ears, and if there's any nodules, and there's none felt, and that feels okay. All right, very good. So far, so good. So what we're going to do next is, Jarrell, is I'm going to check your neck, your thyroid, and your carotids, and your trachea. Okay? Well, before I do that, let's finish with the eye assessment first. What I would like you to do is, can you cover one of your eyes for me, please? And hold this, and can you read this line for me across?
FGHKLPM2Z.
Okay. Now what I would like you to do is to take and cover this eye, and then I want you to read this line right here backwards for me, please.
4HY2QRS57.
Okay, very good. All right, now we're ready to move on, and what I'm going to do is assess your neck area and stuff. I'm going to be checking your carotids, and I'm going to be checking your thyroids and your trachea. Okay, so what I'm going to do first, and I'm going to feel. Okay, very good. Very good, and we're going to check the trachea. Very good. Okay, can you swallow for me? Good, very good. Okay. Okay. Now I'm gonna feel your carotids, your pulse. Very good. And now I'm gonna listen to both of them. Okay. Very good. Okay. Now what I would like you to do, Jarrell, is just sit up straight for me and just relax your shoulders and just let me just look at you for a second there. Okay, I was just checking your breathing to see if everything moves symmetrically, and that does look good. So what I would like you to do is lay down for me. All right, what I'm going to do now is I'm going to listen to your anterior chest. Okay. Okay. Now I'm going to just feel and see if there's, okay, great. Any nodules, any nodes, anything, any masses. Okay. Very good. Okay. I'm just going to listen again. I'm just listening to your heartbeat right now, and you have a very regular heart. And if this was a real assessment, I would be counting your apical pulse, okay, which is your heartbeat. Okay, so what I'm going to do now is I'm going to just tap, and what I want you to do is just tell me if you feel any tenderness or anything, okay? All right, here we go. Okay, how's that? No tenderness or anything? Very good. What I would like you to do is take some deep breaths in and out for me. Breathe in through your nose and out through your mouth. Okay? And I'm just going to, while you're doing that, okay, can you just take a deep breath for me? Okay, and then let it out. Very good. Okay, now we're going to assess your abdomen. I just want you to relax your hands at your side. Okay? And because this is a student assessment and the patient does not want me to expose him, I'm going to do this on top of his shirt. But this is, if this was an actual assessment, my patient would have a gown on and I would be exposing him and covering up the area that is not needed. Okay. What I'm doing now is listening for your bowel sounds, okay? very good. What I'm going to do now is I'm just going to touch and I'm just going to be feeling. See if there's any masses, anything. Okay, very good. This time it feels great. Okay, there's no bulging or anything. Okay? Okay. Alright, and what I'm going to do is feel on this side to see. Take a deep breath in and out. What I'm feeling to see if I can feel your kidney. Very good. And your liver. Okay? Very good. Okay? And on this side, I'll be looking to feel for your spleen. Can you take a deep breath in? Very good. Okay, no tenderness, no pain? Very well. What I'm going to do now is just check your lower extremities. Okay? I'm going to check your pulses. Very good. Okay, I want you to put your feet real straight for me. Yeah, just like this, and point them up like this for you, and I want you to push on my hand. And very good. Okay, that completes our assessment. Thank you very much.
Thank you.
They didn't see my face, but they saw a body.
Mm-hmm.